Cancer physicians love screening tests. In our ideal world, we'd have a simple, reliable test, ideally a blood test, that would detect serious cancers at an early stage when they're still amenable to treatment. We could treat these early cancers and prevent them progressing to life-threatening conditions. Over the last decade, there have been some randomized trials around the world, one in the United States, one in Europe, that have looked at the efficacy of PSA as a screening test, and the results have been somewhat ambivalent. It seems that if PSA is used intensively, it can reduce the number of deaths from prostate cancer within a population. The problem is that PSA seems to pick up an enormous number of very mild, very early prostate cancers that have no lethal potential whatsoever, and thus exposes an awful lot of men to overtreatment. So there may be some benefits from intensive screening, but there certainly were a lot of harms. The CAP trial aimed to reduce the intensity of the PSA screening. It was a one-time call to men between about 50 and 70 to come in for a PSA test, with the hope that they would reduce the number of inconsequential cancers that were detected, while at the same time still picking up serious cancers and hopefully reducing the number of deaths. Unfortunately, that doesn't seem to have been the case. The low-intensity screening hasn't had any impact on cancer death. And at 10 years at least, maybe that will change over the next decade, but at 10 years there isn't even a hint of an improvement in survival for men who underwent screening. And unfortunately, low-intensity screening still picks up a very large number of men with these tiny little cancers and exposes them to treatment with all its risks. So unfortunately, just as high-intensity screening falls short using PSA, so low-intensity screening seems to fall short as well. PSA really is not an ideal screening test in prostate cancer. If a man chooses to have a PSA test, he needs to be aware that he's setting in motion a chain of events that may result in the detection of a tiny, unimportant cancer. He may end up being treated for that cancer and suffering the harms of treatment without any benefit. There are men, likely men with strong family histories of prostate cancer, maybe Afro-Caribbean men, with a higher incidence of prostate cancer, who may yet benefit from PSA screening and who may want to know whether they have prostate cancer or not. For these men, it will be a discussion between them and their primary care physician as to whether or not they choose to have a PSA test. I personally, on the basis of this evidence and other evidence that I've seen, have chosen not to have a PSA test, and I'm 59 years of age.